Now coming to the third muscle of the soft palate, that is the musculus uvuli muscle. This musculus uvuli muscle originates from the posterior nasal spine, which is lying on the hard palate. And if you remember, when we were discussing the base of the skull, I have shown you that projection posteriorly, that is posterior nasal spine. And the insertion of musculus uvuli muscle is, it is also inserting into the palatine aponeurosis. So originating from the posterior nasal spine and getting inserted into palatine aponeurosis. So very small muscle, and what happens, it actually get merged with the uvula. Means when it is inserting, it is merging with the uvula, and this is about the origin insertion of musculus uvuli muscle. Now what is the action of musculus uvuli muscle? This musculus uvuli muscle deviate the uvula to the same side. So it is deviating the uvula to the same side. Now coming to the fourth muscle of this soft palate, we have got palatopharyngeus muscle. So this palatopharyngeus muscle is the fourth muscle in this category, and it is a very important muscle. It is originating from the palatine aponeurosis. So this muscle is originating from the palatine aponeurosis, and it is inserting into following structures. It is inserting onto the thyroid cartilage lamina. So on the lamina of thyroid cartilage on the posterior border, it is inserting. It is also inserting into U-shaped loop. What happens? Some of the fibers of palatopharyngeus muscle is forming a U-shaped loop posteriorly, and that forms a passavant ridge. And what is the role of this passavant ridge? Is approximation of the pharyngeal arch and closing the pharyngeal isthmus. So the action of palatopharyngeus muscle is also the same. It is closing the pharyngeal isthmus by approximation of the pharyngeal arches. Now this was all about the palatopharyngeus muscle, and we know that actually this palatopharyngeus muscle originate in the form of two fasciculi, that is anterior and posterior fasciculi, and in between these two fasciculi, what passes in between these two fasciculi passes levator villi palatini muscle. So this was all discussion of the fourth muscle in this group. Now coming to the last muscle of soft palate, that is called as palatoglossus muscle. This palatoglossus muscle also originates from palatine aponeurosis, and coming to the insertion, it is inserting into the tongue. To be more specific, it is inserting at the junction of anterior 2/3 and posterior 1/3 of the tongue, and it merges with transverse linguae muscle of the tongue, which is intrinsic muscle of the tongue. It is merging with the transverse linguae muscle of the tongue. So this is all about palatoglossus muscle. The role of palatoglossus muscle is closing the oral cavity, means oropharyngeal isthmus. It is closing the oropharyngeal isthmus. So we have discussed all the muscles here. Now what happens, if you will see in the case of soft palate, these muscles are forming three loops around the soft palate. Levator villi palatini muscle is forming a U-shaped loop which is hanging superiorly, and it is elevating the soft palate. The palatopharyngeus muscle is forming passavant ridge, which is a U-shaped loop which is passing posteriorly, and it is closing the pharyngeal isthmus. Now coming to the palatoglossus arch, means it is also, this palatoglossus muscle is also forming a U-shaped loop, and which is supporting soft palate inferiorly. So this is all about the soft palate muscle. Now coming to the nerve supply, and we have already discussed the action along with the individual muscle. Now coming to the nerve supply, arterial supply, and the applied anatomy of soft palate. Now coming to the nerve supply, sympathetic nerve supply, which is secretomotor fiber. Which fibers it carries? It carries secretomotor fibers. The preganglionic parasympathetic fibers arises from superior salivary nucleus. Where is the superior salivary nucleus located? The superior salivary nucleus is located in the pons, and from there the fibers passes subsequently as following. It passes through the greater petrosal nerve, it passes through forming nerve of pterygoid canal. From there post-ganglionic fibers arises, and ultimately it gives secretomotor fibers to the soft palate. So this is all about the parasympathetic supply. Now coming to the sensory supply and the general sensation supply, this is all by the glossopharyngeal nerve along with its greater and lesser palatine nerves. So general sensation is by glossopharyngeal nerve. Special sensation of taste is also by the glossopharyngeal nerve. So we have seen it has got parasympathetic supply, it has got sensory supply. Now coming to arterial supply of soft palate. The arteries, the major arteries which is giving blood supply to the palate is following. It is by ascending palatine artery. Ascending palatine artery is a branch of facial artery. We have also got palatine branch of ascending pharyngeal artery. We have also got greater palatine artery and lesser palatine artery. So these all artery give blood supply to the soft palate. Now coming to venous drainage, it is through pterygoid venous plexus. Venous drainage is through pterygoid venous plexus. So we have discussed in detail about the origin, insertion, nerve supply, action, arterial supply and venous drainage of the soft palate. Now before that I would like also to stress about the applied anatomy. Now generally what happens in the children, there is common the diphtheria. So if the children has got diphtheria infection, what will happen? The soft palate muscles is paralyzed, and in these children who have got diphtheria, there is problem with the action of soft muscles. So what will happen? They will have nasal tone when they speak. When they speak, there will be nasal tone in their speaking, and also foods will regurgitate through the nasal cavity. So regurgitation of food through nasal cavity, this is a common deformity which is seen in the case of diphtheria because soft muscles has been paralyzed. Now one more thing I just want to explain, if we see the structures in the soft palate, if we go from above to downwards, so following structures are seen. Firstly, the nasopharynx mucous membrane, thereafter we have got the other muscles like we have got anterior, we have got palatine glands, then we have got anterior fasciculi or palatopharyngeus muscle, we have got levator villi palatini muscle, then we have got the posterior fasciculi of the levator villi palatini muscle, palatine aponeurosis which is containing musculus uvuli muscle, and below that we have got we have got the other muscle, that is the we have got glossopharyngeus muscle. So this is all palatoglossus muscle, the exact name is palatoglossus muscle, and below that we have got the oral mucosa. So all these structures are forming the soft palate. So this is all about the soft palate. We have discussed in detail about the soft palate, where it is located just in between the junction of nasal and oral cavity. To be more specific, it is lying below, it is lying in the floor, at the junction of floor of nasal cavity and at the roof of the oral cavity. Has got 5 muscles. We have discussed about all these muscles. Actually, palatine aponeurosis is flattened tendon of tensor villi palatini muscle. We have discussed origin, insertion, nerve supply, and we will make diagrams to make you better understand about all these structures of soft palate. So in the examination, when the question comes, you have to write all the details. If the long question comes, you have to make 2 diagrams which I will give you. Along with this, you have to, one diagram is for the location of the soft palate, another diagram is showing the muscles, and also we can make a diagram if you want to earn more marks. So you have to make a simple line diagram showing how the passavant ridge is formed by the posterior U-shaped loop of palatopharyngeus muscle. So this is all about soft palate. Thank you.